अल्लाह मियाँ दे के भी आज़माता है और ले के भी आज़माता है। ये वो बीमारी है जो अल्लाह मियाँ आसूदगी दे कर आज़माता है, because it's a disease primarily of the effluents. Over last 30 years, the global rate of obesity has almost doubled, reaching around 2 billion adults and around 500 million young people who are obese. And if unintervened, this trend will, the future prediction is that it will again double by the mid-century. This is the data which shows from 2010 to 2015 and then projection to 2030, how the obesity is slowly creeping in and disabling the people. Now, it all starts with affluence. I remember in our young days, there were less cars, open grounds, no TVs. एक चैनल होता था जिसको 6 बजे शुरू होकर 10 बजे बंद हो जाता था, और early to bed and early to rise, that was the slogan. Now you have computers, you have remote controls. So life is becoming more and more sedentary, less and less movement, and this all leads to weight gain. And it starts here. And if you go even further, this is the situation. So these are the things which we must try to change right from the very beginning if you have to prevent obesity. This is the different stages of obesity which you classify. Now, as a cardiologist, I am concerned with obesity because obesity is directly linked with diabetes. And 86% of the people with type 2 diabetes are living with overweight and obesity. Around 50% of deaths related to type 2 diabetes are due to cardiovascular causes. And 80% of people with coronary artery disease are living with overweight and obesity. Now, obesity, diabetes, and cardiovascular problems, they are hand in hand. Obesity involves almost every system of the body, and no system is spared. This picture, this is typical of what obesity does to the human body. Look at this bike. This motorbike is not designed to bear such a load. The only thing you can predict is that this bike will not have a natural death. If this person keeps on riding this bike, very soon the engine will fail. And that's what happens to the human body also. अल्लाह मियाँ ने आपकी बॉडी इस वज़न को बर्दाश्त करने के लिए नहीं डिज़ाइन की. जब आप इस पे इतना लोड डालेंगे तो ये डेफिनेटली इस पे असर आएगा. Even with moderate BMI, you lose 3 years of your lifespan. And with severe obesity, you lose around 10 years of your lifespan, which is as bad as smoking. We know if you control your obesity, you can improve your glycemic control, your blood pressure control, and your dyslipidemia. This data which shows us that improved metabolic control is achieved by reducing weight loss, reduce the use of medication, improved comorbidities, and decreased mortality. Just by losing moderate amount of weight in diabetic patient, you can achieve all these parameters. Interestingly, if you gain around 2.5 kg of weight, you have a certain degree of risk, cardiovascular risk. However, if you lose 2.5 kg of weight, the benefit is much more. So you don't need to lose a lot of weight to get these benefits. Even a moderate weight loss of around 10 kg will give you all these benefits in mortality, diabetic control, hypertension, lipids, blood clotting indices, physical complications, and even in ovarian function. So a moderate amount of weight loss can lead to lots of benefits. If you look at the clinical implications, the benefits, they start even losing as low as 3% of the weight loss. This helps in gaining your blood pressure, improves in diabetic control, sleep apnea, non-alcoholic fatty liver disease, osteoarthritis. All these benefits, they are achieved by even as low as 3% of weight loss. Now, can obesity be cured? What do the experts say? The important thing is, they say, diet and exercise just aren't enough to address obesity. And obese people who have lost weight are considered to be in remission rather than cured. Because it has been seen that weight maintenance is the main issue. Also, obesity is one of the most refractory disorders in the medicine. Odds of recovering from the most forms of cancers are substantially better than those for controlling excess fat. And maintenance of significant weight loss is difficult for most of the obese patients. If you see, they achieve weight loss 43%, by 2.8 years it was reduced to 38, and by the end of 3 years only 13% of the patients they maintained. It's rare to be both obese and healthy for a long time. How to start? The main thing is to change your eating habits first, to discipline your eating habits. You have to decide which way you have to go. There are lots of myths कि हम सब्ज़ चाय पिएंगे तो ये हो जाएगा. इस किस्म के चीज़ों पे लोगों ने बहुत पैसा बनाया है. याद रखें, ग्रीन टी से आपका वज़न तभी कम होगा जब आप खुद पहाड़ पर इसके पत्ते तोड़ने जाएं. बाकी सब वहम है. Food is the most abused anxiety drug. Exercise is the most underutilized antidepressant. Weight loss in obese patients, you know, there are lots of behavioral issues with the obese patients. You have to involve a psychologist, a psychiatrist, behavioral modification, and always remember that weight control is a journey, it's not a destination. Because old habits, they take a lot of time to recover. There is one paradox in life, जो कि ज़िंदगी की हकीकत है. Just when your income starts reaching a point where food prices don't matter, calories they start matter. The mainstay of management in obesity is, first of all, diet and nutrition, physical activity, lifestyle modification, and pharmacotherapy. We know that weight maintenance, unless intervened, will not be maintained. So you have to, most people with obesity will require some medication to achieve significant weight loss. Now, whom do you start with medication? Anyone with a BMI of 30 who doesn't reduce the required or recommended weight loss of 1 pound per week should be initiated with pharmacotherapy, or someone with a BMI of more than 27 with other risk factors. There बहुत सी दवाइयाँ आई हैं, there is a long list of medication, but most of them they were not, they didn't deliver, they didn't work, except for a new group of medicine, these GLP-1 inhibitors. And there's a, you can see, not every GLP-1 receptor agonist is, it works. It's not a class effect. Some of them, they are much better than the others. They work because GLP-1 receptors, जैसे अभी फजल साहब ने बताया, they work at different sites, and the cumulative effect leads to lots of benefits. It works on pancreas, heart, kidneys, brain, stomach, liver, and ultimately leading to reduce in MACE, reduce risk in myocardial infarction, risk of stroke, reduce risk in death from cardiovascular causes, decrease in risk of hospitalization due to heart failure, and decrease risk of adverse kidney outcome. These are all benefits which you get from GLP-1 receptor agonists. So there have been different trials. I'll not go into the detail. They all proved benefit from GLP in weight reduction, in diabetes control. There's all the series of trials. There's a significant cardiovascular risk reduction. Side effects, the main side effect is GI-related nausea and vomiting. They are very significant. Other risk factors include diabetic retinopathy, thyroid cancers, and all these things you have to monitor. What is the best treatment for obesity? There is no one treatment for obesity that is best. Finding something that works for you can depend on a lot of things, including your lifestyle and general level of health. Obesity is not a personal failing. It is a complicated disease that requires lifelong management. Fortunately, more treatment options are available than ever before. Work together with your doctor to get control of your weight and your health. And in the end, don't take life too seriously. Nobody makes it alive anyway.